if you would stand up. She's the site manager for probably the world's largest beverage alcohol.
Good morning, everyone. Thanks so much for joining me. We are going live to a press conference that's happening right now in Lebanon Junction. The officials there, they're making an announcement between UofL Health and the city of Lebanon Junction and EMS partnership. Let's jump in. They just started a few minutes ago.
There you go. Thank you, Raylan, for being here today.
Absolutely.
And, would you like to say a word or two?
I would.
So this whole day is very awesome for the entire county, all of us. Thank you so much from the Chamber of Commerce. I know you've done so much work with emergency services. Thank you to UofL Health. You guys have done so much for our community in just the last few months, and I'm looking forward to what you guys are going to do in the future. Then also, just as a personal note, and I think Jerry knows this story, but 8 years ago, my dad, was actually very ill, and we called for an ambulance. It took us 6 hours. 6 hours. And that has changed. So every time I see a new ambulance, I get so excited, and I'm so excited for all of this work that's happening. So on behalf of the Chamber of Commerce, but also personally, thank you. So,
Yay.
Thank you, Raylan. At this time, I've seen a couple more public officials who I'd like to thank Brian Whitaker for being here, our jailer. And also a retired magistrate, Joe Rayhill. Joe. I don't want to leave anybody out because this is so special. This has been quite the adventure for us. I do have a couple of short comments over here real quick. We couldn't have done this without the great relationships that we've established with the city of Lebanon Junction, the mayor, the city council, with Bullitt County Fiscal Court, Bullitt County EMS, and in particular UofL Health South, in particular Dory Shelburne, who's here today. The relationship and the bond that we've made, we have brought healthcare to the next level in this community. And as you can see by the outpouring of this community here today, it's been well received, and we're so excited to continue to grow as a community, grow as public services, and that's our commitment as public servants. We have the obligation to do the best that we can for our constituents with the resources that we have available. And this is why we're all here today. The cities of Lebanon Junction, Bullitt County Fiscal Court, we're providing an opportunity to what used to be limited opportunities for healthcare and services, now to be some of the best anywhere, not only in our county, but the surrounding communities as well. And so at this time, I would like to bring a good friend of mine who's became a friend over the years up here to the podium to speak, Mayor of Lebanon Junction, Larry Dangerfield. Larry?
He don't know what he's asking. He asked me to talk. I get started, I won't shut up. But I'd like to thank everybody, as he said again, for those who showed up and here to turn out. Two people we didn't get mentioned beside the council was I got a police chief back here and a fire chief. And with that, I'd like to, I'm just heartfelt over this building, over the UofL putting their portion into it. Like on Dory a while ago, you make so many friends through these ordeals and these hoops that you jump. But it's just a short time ago, and just bear with me a moment, I know what I want to say here. A short time ago, we talked about the ambulances. We had to depend on one to come from Shepherdville or Claremont to here. And I asked the judge way back, can we get an ambulance out here sometime? And we got one part-time. And that somewhat enhanced our fire department. And the chief stepped up, and the fire department's grown and so much better. The police department's better. So coming around the corner, because they're all right in the row, now we have an EMS. And not only do we have an ambulance here constantly, we have a building. And this building is phenomenal. It just is. And then Dory and them come along and UofL, and they put their building on the end of this one. So proud part of this is, as you're coming into Bullitt County, you got UofL, going out, you got UofL. So, when you look at a U of L sign, it just stands out. It just U of L is U of L. I don't care how little the letters are, how big it is. It's always the importance of what's behind U of L. It is just is. And with that, I'd like to say I got approached by somebody, a few of the local people, about Lebanon Junction starting to grow. I mean, Bullitt County's growing. It's the last one. At one time, for those who don't know it, Lebanon Junction was the biggest city in the county at one time. If you go over and look at the archives, the pictures and stuff, Lebanon Junction was monstrous. The old timers used to say they didn't get to be the courthouse area for the city because the county itself, because they was at the end, not in the central portion. And over years, like everything has died, and where this person came to me was about the fact that we lost an old, long time family-owned store right here. And they fussed about it being old. We tore it down. They fussed over, tore it down. Right here was a liquor store. Chris Arns had a liquor store back turn of the century. Right behind it here was the railroad restaurant. Been here since the turn of the century. And then railroaders all came and used, they ate lunch, they did that there, and the Sullivan family had it, and it's part of history. It just was. But it got depleted, so this other thing does, it's gone. So my answer to that person was this: it's gone, it's tore down, it's a part of history. But with these two new buildings, we're starting a new history from this day forward. So in moving forward, and you have to start somewhere. And our growth, we're getting the distribution buildings, we're getting, and it's coming more every day. They're tearing up ground up the road here for some new buildings. But to be the iconic start of what I'm going to say is a new history in the making was these two buildings. Now, I do know this, and I'm going to get out of here, that when Trackside was here, my dad, he dragged me in there and out of there, and every kid in town went through there. You get a Coke, get a candy bar, whatever it took to get your dad pacified that you was with him, there he was. But they could have really used an ambulance and a doctor's building in that establishment. I've seen blood in every corner of that building. So anyway, with that, again, I'd like to thank everybody for all your heartfelt. The fiscal court stepped up and they promised it, and it's here. So if you hear anything about Santa Claus or Easter Bunny, there is good in promises, I'm telling you. So thank y'all again.
Thank you, Larry. At this time, our director EMS is here, and I'm going to tell you a little bit about him. He just got back from North Carolina like at 11 o'clock last night to be down here this morning. So if his eyes seem a little swollen, you know he's needing some rest. But Chris, at this time, a few comments from you.
Good morning, everyone. Give me just a second. I didn't print it, but I have it on my cell phone like most people today. Got a little speech prepared, so excuse me if I'm looking down a lot. But good morning. First and foremost, I'd like to thank all of you all for being here. Like Summer says, and Larry, Mayor Dangerfield says, this is a big moment for Lebanon Junction, Bullitt County EMS, and UofL. Like Judge Summers said, my name is Chris Hale. I'm the director here at Bullitt County EMS, and I'm honored to be able to speak with you all today and to be a part of this grand opening. Prior to us having an ambulance down here, our call volume was very few and far between. No one called EMS for anything. They toughed it out, or they didn't go to the hospital, or they called and it was too late. Since we put a unit down here back in 2021, our call volume has doubled. With that, it's awesome that the community knows we're here for them. The community knows that we're here to support them. They have access to care, and we're able to provide better services. As someone mentioned earlier, 6 hours waiting on an ambulance is insane. Our call volume just over the past couple of years has went from 12 to 20 minutes, or not our call volume, I'm sorry, our response time, 12 and 20 minutes down to below 8 minutes in this area. So that's a huge deal for us. To continue, today wouldn't be possible without the help and dedication of Judge Summers, Mayor Dangerfield, the magistrates, and most importantly, the citizens here in Lebanon Junction and throughout Bullitt County. I want to take a moment to show some appreciation, if you all don't mind, to give everyone a round of applause. This building and this opening doesn't just represent a new station and a new healthcare clinic. It represents and closes the bridges and the gap in healthcare to this area. This will allow this community to have the quick access that they deserve and need. In my brief time here as a director, again, I've watched the area, the county, and the city grow. Days like today definitely make the long nights, the hard work that everyone puts in worth it. This station provides a calm, safe environment for all of our providers that do this chaotic job, spend time away from their families and work hard to provide the care and service to all the citizens. So without further ado, I'm honored to welcome all of you all for the first time to our brand new EMS station and to the UofL Primary Health Clinic.
So let me see if it's him or Dory. One, two. The Dory. Hey, yes. Hey. Wade Mitchell. Wade's the Chief Operating Officer and he's head of all the physicians and work at UofL Health. At this time, Wade, we'd like to have a few comments from you, and then we'll do Dory. We'll save the best for her.
Well, a little history about who I am. I started my career, interesting a lot, and been in healthcare for 34 years. And I started, one of my favorite milestones is I started as a paramedic and in a rural healthcare system in a building very similar to this. So it brings back PTSD, just a lot of memories, a lot of great memories. So it's important that, as we look at what this means to our community, it's crucial. And I'm so honored to be here as part of the partnership. I know that when people drive by and they see this building, that they see the important people behind it, that they know that there's EMS people that are willing to come at a moment's notice and to help them when they're need, the police department and fire. And that UofL Health is so honored to be here because we are building a stronger community. And we're so honored to be here to be a part of that. So we celebrate not just a primary care office opening, but building stronger communities and the partnership that we have. So Judge Sumner, Mayor Dangerfield, Director Hale, Dory, Dr. Pallet, we're just honored to be here and we're so thankful for all that you do. The one thing that Dr. Pallet, who you're going to meet after Dory, you're getting a very special provider. She really cares. She doesn't like to talk in front of a podium and stuff, so that'll be fun to see what she says there. But why I'm so excited for her to be here is that she cares. She cares about people, she cares about the community, and it's going to be so important to have primary care access here in Lebanon Junction. And it's going to be an honor to see and to be a part of what she does and what we do throughout that. UofL Physicians is dedicated to expand physician services in our region. And it is an honor, Mayor, to say that we are not just going to start a history here, but we are here for the long term. And we're going to be here and continue to build services throughout this area because we know how important the citizens of this community are. And, we've had a lot of expansion, and I want to share some of that expansion that we've done in this area in Bullock County. So we're building a multidisciplinary clinic that has like 7 subspecialties, things like nephrology, chronic pain management, ENT services. We're creating a women's center for OBGYN specialty services at our sister hospital at Marion Elizabeth South, but it's going to be connected, and we're going to create care paths that families in this area can have that ability and have the birthing place right here in this county. We're building a new brain and spine institute that will be at South Hospital. That includes like neurology, neurosurgery, and expanded services there. And we're adding over 10 subspecialties to the South Hospital, the Hester building and the clinic there. So working with Dory, it's been an honor to see the different growth that we're able to bring here. And I'm hoping to expand services even to this building as there's needs and as we grow. So it is an honor to be here. I want to thank you. I want to thank the EMS and the fire and the police for all that you do. And to be a part of your building is truly an honor as we move forward. So with that, I'd like to give Dory or Good Sumners.
No, go right ahead. Dory is the true rock star of all this. I mean,
I am not the rock star. I'm the face. I'm going to tell you that there are so many people that have been a part of this journey, and your sentiments are exact. The friends that you make along this way, it's been such an amazing journey, and the journey has just begun. I do want to say this Friday marks the 5-year anniversary for UofL Health becoming a system. So what an incredible way for us to celebrate that. With that being said, right as we became a system, we sat down and we worked on what is our mission? What is our mission as UofL Health? And I hear Tom Miller say it all the time. It's to improve the health care of our communities that we serve. And this is the beginning of that. And again, just an incredible journey. I will say South Hospital has now been open for 7 months. We have outgrown our space. I'm sure many of you guys already knew that was going to happen. We probably outgrew the space about 2 months after we were open. So we are working with an architect now to see how we will be able to build out some of our shell space to add more beds, to expand our ER services. The ER has just exploded since we've opened, not only with volume, but acuity. The Bullitt County EMS system has been incredibly supportive of our ER, and we have a great partnership with them. Some of the other things just in this last 7 months after we opened that we've announced and that we're working on is, if you're not familiar, we received a $25 million grant from the state to build a full-service brown cancer center right on our campus. And this is not just a small service where you go in and you see your oncologist. This is really state-of-the-art. We will have all services cancer-related. All of our specialty physicians for cancer will be on that site, seeing patients there. RADOC, on chemotherapy, all of those types of things will be done there. And we will also have the opportunity to have clinical trials at that site. And you really do not see that in a community setting. That's usually in a very urban setting, but this is amazing. The other things, we have purchased the historic Hester building across the street and working on that. Construction is going to be complete on the first phase of that. We're hoping in December. We'll be moving our primary care, Dr. Paleth and her team, and Dr. Ko and Jamie Greenert will all be moving over there into a very fine office. We will also be moving our orthopedic services from the Plaza 1 that we currently have over to Plaza 2. It's a much larger office. We brought on 2 orthopods, that Dr. Richards and Dr. Schweitzer-Gross. These guys are amazing. One thing that I tell people is the physicians, the level of knowledge and skill set that these physicians that we have brought to South Hospital is just unbelievable. Most all of our physicians actually work at the downtown tertiary centers or have worked at the tertiary centers for many years. So it's just incredible that they're here, they're dedicated, and they're supporting. We will continue to grow. We'll be bringing urology services in that first phase of the primary care. And then last but not least, our primary care clinic here. And Dr. Paleth, you're going to meet her in just a second. She is our first physician that we'll be bringing here, but we will also be speaking to all of our specialists such as cardiology, possibly nephrology, pulmonology, and they will be rotating down through this area too. So the people that have transportation challenges, mobility challenges, they'll be able to just come to their backyard and see their specialist. So very excited about that. I think I kind of went way off script. Sorry, Lanny. Where she is. But anyway, with all due, thank you. Thank you to the community. Thank you so much to the judge, all the mayors. It has been an incredible ride, and that ride has just started. I want to introduce Dr. Pallet. Again, she doesn't want to talk behind here, but she promised me she would. Dr. Pallet is not only a fabulous physician, but she is my physician. And she is one of the most amazing people that I've ever met. I am a terrible patient. I'm sorry, but she is amazing.
Hi everyone, I'm Dr. Pallath. I'm not used to having this mic. If you have me in a room with a patient and a computer, I'm happy. And what I don't. All right, so I've been working as a primary care physician at Medical Center South for the last 2 years. I did my internal medicine residency in Chicago Medical School, Rosalind Franklin University. And we moved here 2 years ago, and it has been an amazing experience with the whole team of UofL Health and also the team at the Medical Center South. It has been an amazing experience. So this is a new beginning for all of us. And when there were already talks about starting this primary care setup at Lebanon Junction, and when our supervisor came and talked to me about it, I was initially skeptical because it's like a 2-hour commute for me. So, my project manager, Amber, she took me here, and I could understand why they are setting up this primary care, office here, and I could understand the need of healthcare facility here, and that was an easy yes after that. So I'm really excited to be here, and I'm really honored to be, a part of this healthcare team. In providing the best healthcare services to this whole community. And I think this is a great first step with the UofL Health in setting up a healthy community here at Lebanon Junction. Thank you.
Thank you, Doc. And a couple of housekeeping. First of all, I would like to thank our food sponsor, Trina Summers, for whipping up this great meal for us and taking it out of her monthly salary. Trina, thank you so much. And we're going to do a ribbon cutting up front. And for courtesy, what we'd like to have the Lebanon Junction City Council and the Bullock County Fiscal Court, and this group up here, like on the front row, and then anybody else that can squeeze in the picture, it would be absolutely terrific. So at this time, Lanny, or Madam President, where'd she go? Braylon? There you go. If we can get this going, we're going to do the ribbon cutting up front, and then we'll go to we'll have some lunch. Thank you all for being here today.
How are you? How you doing? Hi, Carrie. Was that good time? Yeah, I will treat you.
I did go and check on it.
Sure.
The doorway walk, and I'll get front and center here. All right. Kind of front and center in front of the door. All right. Lynn, send it to me, but you did it wrong. You did, everybody.
Yeah, did. We well, he came in there. We told him what.
Everybody.
The roof.
Judge and I. Yeah. I know. No way.
You know,
I don't want you to forget. That's my friend. Oh, I'm right in front of you. I'm sorry.
we'll give you all a count.
Everybody, where everybody can line up, please, and get in front of the truck. Kind of lined up next to the center right there. Come on, Jim, get me. There you go. Really? Mayor and Judge, if you all get in the center there.
You're sure.
Yeah, right?
Probably at some point had been in your kind of.
Bringing it back.
I don't have to. I'm used to being in the back and not being noticed.
You all might want to support the way to blow it over on it.
All right, we ready? I'm not cutting.
No, I don't have about half of it.
Get close.
Everybody start squeezing in.
We're all friends here.
There you go. Still moving.
Are we gonna do a countdown? We're gonna
Yes.
take it from 5. 5,
4, 3, 2, 1.
Here we go.
Gary, do you have the marker?
Kaylee's got that.
Is that okay?
Perfectly fine.
We'll see where it's at if we need to move it.
You just tell me who you want.
So I didn't sound too bad. I don't know what I'm going to say. When I get up there, just turn me loose.
Go get some lunch. Actually, lunch.
I could ask the questions, but mostly just talking about the and then of course I'm extremely
All right. paperwork to you, sir. We have paperwork.
Oh, no, you're not gonna go. You don't understand.
I don't want to keep directly in sunlight.
Treat me nice.
So this is good. You want to do glasses on or not off?
Preferably on, because if not, I'm gonna squint.
Okay. I just wanted to make sure. Alright, you just look at me. Okay, we'll just talk, have a conversation. Alright, just first thing is just state your name and spell it.
Okay. My name is Chris Hale, CHRISHALE,
And your title, please.
Director of EMS for Bullitt County.
Tell me a little bit about where we are here today and just what's going on.
We are at the new Bullitt County EMS Lebanon station in Lebanon Junction, and the UofL Primary Health Clinic.
Awesome. Tell me what's going on. What do we have?
So this is the ribbon cutting and the grand opening for both the new Bullitt County EMS UofL Health Clinic EMS station, as well as the UofL Health Clinic. We have everyone from all over Bullitt County and this community here in Lebanon Junction here to welcome these services to the community.
That's awesome. It's like the partnership, just talk about the partnership you have with UofL and all these folks coming together.
Absolutely. So it's been in the works for quite a while before my time here. The partnership between Lebanon Junction, the city of Lebanon Junction, all the community here, and the partnership with UofL. And the fiscal court here in Bullitt County, who provides all of our funding and services. Everyone working together to improve the healthcare here in the community has been fantastic. We have a partnership with UofL that would allow our providers to join them in providing some of the care at their clinic, which is going to be amazing and phenomenal to increase the education and the things that our providers are able to do.
That's awesome. So just talk a little bit about just some of the services and kind of what it was, what it looked like, and now what it looks like.
Previously, we did not have an EMS service. I'm sorry. Previously, we did not have an ambulance here in Lebanon Junction. Like we said earlier, we had to respond from Shepherdsville, and that would take anywhere from 20, 25, 30 minutes to get here if we had a unit available in Shepherdsville. One young lady, she reminisced that it took 6 hours to get to one of her family members. We've been able to reduce that time to below 8 minutes and get to people quicker and sooner and save lives here by being here in Lebanon Junction.
Let's talk a little bit about, obviously you have the building, you have the new doctor's office, they'll have UofL Health, they'll have new patients clinic, and just kind of talk about how that's just going to make everything here a lot easier, a lot safer. You know.
Absolutely. The access to care that the citizens here in Lebanon Junction now have is going to be phenomenal for them. People without transportation, people without easy access to healthcare in surrounding counties, or even up north at the new UofL Hospital South, they'll be able to come here and get their healthcare needs met. And then if they need something urgent or more immediate, out in the community or even at the doctor's office, we're right here to provide that care and get them to their appropriate facilities as well.
Yeah, obviously, you know, this is your profession, you know, but you have family, you have relatives here in the community. How do you feel personally just knowing that this is a service that you're going to have?
Absolutely. Personally, I think that the community here and the friends and family that I have here are going to be served tremendously, and I don't have to worry about the care that they're going to receive later on down the road.
Anything else? Any other questions maybe I didn't ask? Is something you'd like to say about going forward?
Yes. So I look forward to the increased care that the people have here, and the growth that Mr. Wade mentioned that's going to take place here, and look forward to this whole community growing.
Does it feel like having all these folks show up and celebrate this great thing?
It's amazing to have everyone here showing their support for not only the citizens of Lebanon Junction, but for Bullitt County EMS and UofL Healthcare.
Thank you. Appreciate it.
Absolutely.
I'll grab that mic real quick.
Thank you.
Yeah.
Sorry.
So now there are folks that are gathering, just eating lunch. If you
Yeah.
want to get that, or if you want to get some video inside the clinic, you can do that instead.
Okay, let's do. I may go get a couple shots just inside.
And if you want any more from us, Rebecca Osmond is the deputy director, and she is great.
Okay. Okay, great. I'll ask him if he needs it.
Drop off.
So if someone comes in and they literally need an ambulance.
So part of this
I mean, it's the
CSX
same.
railroad, and part of it goes to.
So if you want to get video of that real quick,
One shot.
probably better than people eating.
Yeah, of course.
They've got 3 in Lebanon Junction alone. Yeah.
So South Hospital obviously is like 30 minutes away.
Right.
And this is the new primary care practice.
I'll get that door.
Yeah, of course. Is it okay if you just get some shots of some of the patient eyes?
For sure. Yes. Get my good angle.
Hey. Thank you guys.
Yeah, you're literally a door away. Right?
Literally, that's the
Wait
thing.
for just a second, because I do have a patient. No worries. We'll go in 2. 2 is where I wanted to bring you anyway. So get some video here. Some live shots in the hall.
Okay.
And the patient just walked into that, so you have more space.